Hello, from Southlake Pediatrics to your family. We hope this video finds you safe and healthy. I'm Dr. Katie Schaefer. I'm one of the pediatricians at Southlake, and I wanted to update you on some of the changes that we're having at our office in an effort to keep people safe and healthy during this time of COVID-19. The first thing I want to let you know is that we are now offering Sunday hours. We know that patients wake up on a Sunday with an earache or a sore throat, and the last place we want you going for help right now is to the emergency room for something simple like that. So we want to be there for you in an effort to help you on those days. So please call our office for the most up-to-date hours and information on those weekend hours, but know that we are there 7 days a week for you right now to help with all your illnesses and concerns. We're also changing the way we do some of our offices with our well visits in an effort to keep sick and healthy separated. We are having our Children's West location be a well visit only location. This means we'll see mental health checks and well care visits there, but no illness symptoms whatsoever. And that also includes if you are not feeling well or another family member that's coming with is not feeling well, we would like to keep them out of our well visit office as well. Keep that in mind. So if that is an issue, please call us and we'll figure out how to reschedule or adjust for the situation. We also are having our nurse practitioners just seeing well children right now. They are also lactation certified, which means they're seeing all of our brand new babies, and we want to keep them as healthy as possible in order to protect some of our most vulnerable population in pediatrics. We continue to offer curbside care at our Minnetonka location. What this is if you call in and you have symptoms of COVID or perhaps an exposure through travel or a family member, this is a way that we can provide healthcare to you while keeping you and other patients and staff safe. We will actually meet you at the car in our full protective gear in order to examine your child, do any tests like flu or strep or anything we think needed, and treat them the best that we can with that situation. We are, as of March 30th, 2020, we will be temporarily closing our Eden Prairie and Plymouth locations. If you are a patient there, please do not worry. We are happy to take care of you at our other 4 locations. Call us and we will help figure out where the closest location for you will be. We are starting to offer telehealth. Telehealth is an opportunity to meet with your provider through a video chat, so you are actually physically seeing them. While in the long run, this is not the most optimum care, and that face-to-face visit with hands-on really is the best. Right now in the current situation, we're all doing what we can to minimize risk and continue to offer the best care that we can. So please call our office if telehealth seems like an option for an upcoming visit you may have. It can be good for things like a mental health care check or perhaps a rash or something simple. There are things like pneumonia or strep throat that you just have to see or have to do a test to know if that's the problem. But call and talk to us and let's see if telehealth would be an option for your child. We also continue to do well child care visits. I know I touched on this with our well child visits and sites at the beginning, but I want to just reiterate the American Academy of Pediatrics has recommended continuing our well child checks. That is because we still see common things. Vaccine preventable illnesses are still a problem, and we still need to protect our children from these other germs that exist. As much as we feel like COVID is everything and the only thing out there right now, it's not. There is a lot more that we need to protect our children from. So continuing that well child care is quite important. And we are trying to figure out and continuing to update how we deliver that to you and your family. But if you have an upcoming child care visit scheduled, please continue to keep those. And finally, we are going to start working as of 3:30 next week on Monday in teams of providers, where we will have some of our providers and staff in the clinic and some that are off for the week. This is in an effort to keep our staff healthy. Because of all the exposures that we have, we're more at risk for being quarantined or having to be out longer just with general illness symptoms. And we want to make sure that we continue to have staff to meet your child's needs. So there may be weeks that you're calling that your provider isn't in the office when maybe you were expecting them to be. but this is a temporary solution to a major problem that we're facing, and we are going to work as a team to make sure that your child's healthcare is seamless and as continuous as possible, and that we're meeting every need that you have. Once again, we are here for you. We are here for your questions and your needs, whether it's talking to your provider, talking to one of our wonderful triage nurses, or helping guide you to good resources for information like the Center for Disease Control and the Minnesota Department of Health. Please know that we will partner with you through this time for whatever your healthcare needs are. Thank you and stay healthy.